Assalamualaikum and good day, students. We will continue on the second part of the lecture in the topic of adverse effects of transfusion. I will continue with the delayed hemolytic transfusion reaction. This transfusion reaction occurs usually after 24 hours but less than 28 days. The common reason is mostly due to secondary immune response following re-exposure to a given red cells antigen. The recipient actually has been previously exposed to foreign antigen in pregnancy or previous transfusion or transplant, and it will produce antibody against the red cells antigen. For example, during pregnancy, probably the fetus has red cells antigen that is absent in the mother. During pregnancy, a minimal amount of fetal blood entering the mother's circulation, and the mother will be exposed to the red cells antigen that is not part of her antigen, and the mother's body will produce antibody against that red cells antigen. But after some time, this antibody level will be reduced and is not detectable by the standard pre-transfusion method. So the antibody screening will be negative. During transfusion, patient may re-expose to that antigen if the donor red cells have that antigen. After a few days of that subsequent transfusion, there will be a rapid increase in the antibody concentration, which we call amnestic response, and this will result in the destruction of the red cells because the antibody will attack the red cells antigen on the donor red cells, and this will cause lysis of the red cells. The hemolysis is usually extravascular because most of the time these immune antibodies are IgG type and they are not IgM type, so they will cause extravascular hemolysis. The common blood antigen that involved in this delayed hemolytic transfusion reaction is Rh, KIT, Duffy, and also Cal antigen. This is the pathophysiology. How does this happen? So for example, during pregnancy, the mother will be exposed to the foreign antigen from the fetal red cells. And then it will take about 1 week after exposure, the mother will produce the antibody against the red cells. And if after delivery, the mother does not being exposed to that antigen anymore, then the antibody level will be very, very low. And if the mother needs transfusion long after her pregnancy, probably the level of antibody cannot be detected by our antibody screening because the concentration of antibody has been very, very low. Subsequently, after transfusion, the donor red cells might contain the antigen against the antibody that the mother has. So, the mother after few days will produce the antibody which is usually IgG, and this will cause lysis of the red cells, and this lysis is usually extravascular lysis. Why do we call this delayed hemolytic transfusion reaction? Because it will take few days to reproduce the antibody inside her circulation. In contrast to the acute hemolytic transfusion reaction, because the IgM, anti-A, anti-B, and anti-A, B is the existing antibody in our circulation, so it does not need time to reproduce it, so it will attack it acutely. That is the difference between the acute and delayed hemolytic transfusion reaction. The clinical features is usually milder than the acute hemolytic transfusion reaction, and sometimes we cannot detect it clinically. But if the patient shows symptoms, they will usually present with fever, anemia, and also mild jaundice. Investigation similar to the acute hemolytic transfusion reaction. And sometimes we can see the lab findings of jaundice. Bilirubin will be slightly high, and direct antiglobulin test will be positive. The patient will be anemic even though the patient has received few pints of blood. And when we send the blood to the blood bank, they will identify the red cells antibody. And in the peripheral blood picture, we will see signs of extravascular hemolysis, such as spherocytes here. How do we want to prevent this from happening? So we need to have pre-transfusion testing which is more sensitive. So it can detect even though the antibody concentration is very low. And also we need to have access to the previous record. Sometimes the patient has been admitted to other hospital, so we could not trace the previous records from there. But if the patient has developed antibody, usually the doctor will tell the patient or the blood bank will issue a card to give to the healthcare professionals in other hospital if they need transfusion, because the card will tell them that they have red cells antibody. And it's also very crucial to have proper history taking of the patient, because we want to know whether this patient has been pregnant before, or history of transfusion before, or history of transplant before. So all these three factors are the major factors of exposure to the foreign red cells antigen. And of course, we need to train our lab staff so that they are more aware how to detect the antibody.